My name is Desire. I'm the nurse working with Dr. Smith today, and I see that you're here for your 3-month checkup for your diabetes and just a general health checkup. Is that correct? All right. Can you tell me your name and date of birth, please?
It's Travis Miller, 1980. It's 1980.
Okay. And what's your age?
43.
Okay. All right. And can you tell me what day it is?
It's September 9th,
Do you know the year?
2023.
All right. So what we're going to do first is the head-to-toe assessment, and this just helps me look over everything and give Dr. Smith any idea of any areas you might be having problems, anything that looks abnormal, so that he can check it out while you're here. Does that sound okay? All right, so while you're sitting there, I'm going to go ahead and check everything on your face, eyes, mouth, okay? Everything on the face appears symmetrical. I'm just going to check your eyes. Pupils equal in diameter and responsive to light. Okay, if you could go for me. All right, any loose teeth or any problems? Okay, everything in the mouth appears good. Oral mucosa is normal color. Okay. Go ahead and lean back here for me. We're gonna get you comfortable. All right, so first I'm gonna check for your pulses on your arms. That's where we usually do in your wrist. This is called the radial pulse. I'm gonna check both of those at the same time. Those are equal in strength bilaterally. No irregular rhythm noted. Okay, and then I'm gonna have you just relax. Now I want you to close your eyes, and I'm gonna touch you on your forearms, and I want you to tell me if you can feel that, okay?
Yes. Yes. Yes.
Okay, so there is bilateral sensation in the forearms. Okay, so for this part of the exam, I'm gonna have to have you take your shirt off. We're going to check for something called skin turgor, and that tells me if you've been drinking your water, because how fast your skin springs back down tells me if you're dehydrated or not, okay? All right. Skin turgor is normal. Everything on the chest and abdomen appears normal, symmetrical bilaterally. Breathing's unlabored. Okay, so I'm just going to take a listen to your heart and your lungs. We'll start out with the heart. You can just relax for this part. All right, now I'm just going to check breathing. So I just need you to take some nice deep breaths for me while I move my stethoscope around on your chest. All right, breath sounds are normal in all lobes bilaterally. And you're having any problems with shortness of breath, trouble when you're breathing, any pain?
No.
Nothing like that? All right. So I'm going to listen to your back, to listen to your lungs again. If you could just swing your feet over the side and then just lean forward and cross your arms over your chest and just kind of try to relax. Lean forward just a little bit more for me. Okay, nice deep breaths for me. All right, breath sounds are good, unlabored, clear in all the lobes bilaterally. Okay, so now we're going to do some strength and range of motion. I'm gonna have you reach and grab my fingers on both hands, squeeze, let go. Okay, strength in the grip is bilaterally strong, normal. All right, so put your arms up like this, and I'm gonna push in on this arm. I want you to not let me. Okay. I'm gonna push out, don't let me. Same thing, push in, don't let me. Push out, don't let me. Awesome, okay. You can relax your arms. Okay, now I want you to lift them and hold them straight in front of you. Put them over your head. Okay, straight in front of you again. Turn your palms to the ceiling. Turn your palms to the floor. Hands down. Hands up to the ceiling. Okay, any pain with any of that? All right, range of motion was normal in all joints. Okay, so we're gonna do an abdominal exam now. I'm gonna listen to your abdomen and feel and see if there's anything abnormal there. Okay, you can go ahead and swing up to you again and relax. I keep telling you to relax, but it's not very relaxing, is it? Can I move this pillow up under your neck a little bit? Is that better? Okay. All right, so any problems, abdominal pain, anything like that?
No.
Looks like you have a scar right there. Is that from surgery?
No, gallbladder removal.
Gallbladder removal. Okay, gotcha. All right, so I'm just going to listen to your bowel sounds, make sure everything's moving like it should. Are you having any trouble with constipation? Any pain with bowel movements? Do you have a bowel movement pretty regularly? Okay. Okay. Normal bowel sounds noted in all 4 quadrants. And now I'm just going to feel. It's called palpation, but I'm just going to check for any lumps, any kind of pain that you might be having that doesn't really show up until you press it. Okay. Any pain with that? Any pain here? Any pain there? Any pain there? Okay. Now there is a little bit of a raised area here, and that looks like it could be scar tissue since it's located right under that surgical incision. Is that what they've told you? Has anybody looked at that for you?
Yes.
Okay. All right. Okay, no other masses or lumps or anything in the abdomen abnormal. All right, so we're gonna move down to the lower body, and I'm gonna check your legs and your feet. Now, I know you are diabetic, so you having any pain, any loss of sensation in your feet, your toes, no numbness, tingling? Okay. All right, so we're gonna check the strength in your feet. I want you to push back against my palm. Okay, and I want you to push up. Okay, same thing with this foot, push down, push up. Okay, all right. And skin on the lower legs looks normal aside from what looks like just some bumps and bruises. You having any trouble with easy bruising? Okay. I'm going to check for what's called edema, which just means fluid buildup down in your legs, feet, and ankles, okay? Okay, no edema noted. And I'm just going to move this up a little bit and check the skin on your thighs. You work outside?
But
Yeah. All right. Okay, I'm just going to check your feeling in your feet and your toes, sensation, okay? Okay, go ahead and close your eyes. You feel that? Sorry.
I'm very ticklish, I'm sorry.
Feel that?
Yes.
Okay. I'm just going to check. Feel that? Okay. Feel that?
Yes.
Okay. All right, so I just need to check your gait. I'd have to have you walk for me and just kind of make sure that there's no problems there. Oh yeah, you can do it without your shoes. Any pain when you walk? Any knee, hip, joint issues? Okay, very good. So do you have any questions for me?
No, ma'am.
Okay, can you kind of repeat back to me what the purpose of the assessment was today?
Just make sure I got all the feeling in my extremities and just basically make sure everything's okay.
Okay, I'm just going to check your chart real quick, make sure I didn't forget anything, and then I will get out of your way so Dr. Smith could come in and check you out. Oh, I do see something I missed. That's okay, because that's what a checklist is for, right?
Yep.
Okay. So I have to check what's called capillary refill, and that means that we are checking your circulation in your hands and your feet, and I will do that by pressing on your nails and seeing how quickly they blanch and then the blood returns back in. Blanching just means kind of turning white, okay? All right, 2 seconds, excellent. Good, 2 seconds. All right, and then I just need to check the speed. Sorry about having to move you around so much. Okay, 2 seconds there. And 2 seconds. All right. And you can go ahead and leave your shoes off. I would say he will probably do your diabetic foot exam since you haven't had it in 6 months.
Okay.
And you can put your shirt back on if you want. He might have you take it back off for the exam, but if he wants you to, he'll let you know.
All right. Thank you.
You are welcome, and I hope you have a great day if I don't see you again before you leave. Thank you.
Well.